So that's more of a metrosexual kind of look. And the skin must be totally flawless and white. Okay, it cannot be any blemish, not a single pock mark, not a single stuck pore. Totally flawless, such that if you drip some water onto the cheeks, it will just drip down without any stains. Okay.
Hi everyone. Today we have Dr. Terence Tan, Medical Director at Halley Medical Aesthetics and Halley Body Slimming Clinic. Okay, so Dr. Tan, today actually I have something that I have thought about quite recently, about Asian men and their looks. So when people talk about like men aesthetics, they often picture people as very muscular, especially with all the Korean idols, they are up and coming. So with a chiseled face and bodies, is there really what most of the guys actually are aiming for when they go to your clinic?
Well, I think that in general, male facial aesthetics is very difficult because there is no one single ideal. So for women, it's easier, right? You want a heart-shaped face, you want a slightly sharper chin, and you want a certain shape. But for men, I think it's a little bit more different. And I would say that everybody is different. But generally, we can classify it into two main types, okay? So you talked about Korean, okay? So the Korean tends to be a little bit more of a metrosexual kind of look, whereby it's very manly, but at the same time, not too rough, okay? And there's also a cowboy look, okay? So whereby it's more of a Western ideal, I guess, but it's also very Asian, whereby we want to look a bit more rough. And a bit more male and more masculine. And there's also another kind of look. So let's talk about maybe the more masculine, more cowboy look first, okay? So in general, the chin is very, very strong, okay? It is a little bit stronger than maybe what we talked about, a little bit more of a metrosexual look. It's very wide. The chin wants to be wider. So in terms of how wide it wants to be, in general, you can say it's about at where the corners of lip are, and that would be the width of the chin, okay? And so it's a bit more square. The jaw line is a bit wider, and that gives a very strong masculine look to the lower face. The skin must look good, but it maybe not totally flawless. You want it to look a little bit more rough, like I've had things done, I have done things in my life and I'm experienced and I'm a dependable person. I'll bring home the bacon or the food and I'll take care of my family. In times of difficulties, I'll be there for you kind of look, right? Then we have got the Korean boy band kind of metrosexual kind of look. So in general, the chin cannot be too sharp either because it's way too feminine, but it need not be really all that wide and square. So in general, let's say we are talking about the shape, the width will be about the width of the outside of our nose or the ala. And if you draw it downwards, that's probably about the width that you want it to be. Not so super sharp, but certainly not so super wide and strong. And that gives a more kind of gentle kind of look. We want the jawline to be nice and wide, but not so wide. And a little bit more chubbiness of the cheeks to give the impression that I'm a little bit younger looking and more virile and young. Okay. And that's a little bit different. And the skin must be totally flawless and white. Okay. It cannot be any blemish, not a single pock mark, not a single stuck pore. Totally flawless, such that if you drip some water onto the cheeks, it would just drip down without any stains. Okay. So that's more of a metrosexual kind of look. So of course, I think I make stereotypes and people don't quite fall into all these categories. There'll be people who want to look even more feminine than a metrosexual. There'll be people who want to look very, very model-like and totally a little bit more distorted looking as compared to even a cowboy look, to the other way around, maybe a little bit goth kind of look. But most of us will be somewhere in between, neither too metrosexual or too cowboy, And I think that's a good look for most of us. And I think really the most important is to have positivity about the way we look. In general, we are born the way we are. Weight changes a little bit, but in general, I think we are who we are. But for those people who want just a healthy, improvement in the way they look, they want to, change their looks a little bit, perhaps a little bit of anti-aging and changing what nature has given us. I think that sometimes seeing a doctor can help, and there are some things that we can do to reach those achieve those things.
But usually, what is the topmost complaint? Like when a patient comes to you, what's the first thing that they always want to do?
Well, they all want to look better. Let's go back to what you said. So yes, we all want to look better, but I think the older ones generally want to look a bit younger and less tired. Maybe there's some eye bags. They have some skin blemishes, some loose skin, and that's generally what our older patients tell us that they want. The younger ones want to have a little bit more contouring, like what we said about just now. Look a bit more muscular, a bit more metrosexual-like, a little bit more cowboyish or whatever, and that's quite common. So let's say for the older ones, generally they want skin tightening, eye bag reduction. They want maybe a little bit of volumization, dry dermal fillers for certain areas where they are really sunken and they look really tired. For the younger ones, generally they want facial shaping, dermal fillers. They want a more prominent chin. They want a slightly rougher look. They want a wider jaw, and that's and they want to have flawless skin. Fairer. A little bit less freckles. So these are true fillers, lasers, or whatever. These are the more popular treatments that we do in our clinic. But more importantly, we should do things in moderation, and shouldn't be too obsessed over it. But let's say if you want to have a very healthy, positive change, then I think that these are the two main categories that we encounter on a daily basis.
So if today there's a guy that's thinking of doing something, what do you think will be a first step suggestion for someone who has done no medical aesthetic treatment before?
I think we've already talked about that before. I think that whoever comes in needs to articulate what really bothers the person, because I think there's so many things that we can do, and the doctor's view, while important, being the expert in the field, I think that equally an expert is the patient. So the patient is not an expert. Well, he may be an expert in medical aesthetics, but the person is an expert at what he likes, and the doctor is not an expert in that field. So you have to have good communication with the doctor, and the doctor needs to customize the treatment to your ideal. So we talked about the two previous types of patients that we have. One who wants to look less tired, a bit younger looking. Then yes, we are talking about skin tightening through ultrasound-based treatments, through radio frequency, mild volumization. Generally, we have some sort of collagen-stimulating kind of filler for a more natural look, better volume, and address skin issues that they are. And then there's also the younger ones, whereby they want to look a little bit different from what they were genetically given. And that will have a little bit more of maybe hyaluronic acid type dermal fillers, skin treatments to resurface the skin to give a really nice look, and perhaps also a little bit of what we call neurotoxins or neuromodulators to reduce some wrinkles somewhere. So these are the approaches that we have, but it's not set in stone.
To summarize, just have a good, honest chat with a professional, and I think you are able to find the best treatment for yourself.
I think so. And most importantly, you have to have two experts. Okay, so one's the patient expert, which is the expert in what the patient wants, and the medical expert or medical aesthetic experts, which is the doctor. And then once these two come together, you generally have a good treatment.